Welcome. We're really happy to have you here with us today. My name is Amy Klaus, and I'm the marketing manager for Brooks Publishing. And today we have Dawn Alexander from the Colonial School District in Newcastle, Delaware with us. This webinar today is going to showcase how Dawn's school district transformed their child find efforts using ASQ. So this webinar is part of our ASQ Innovators webinar series, and that link there on your screen has recordings to other webinars that we've had in this series so far. Before we get started, I just have a few tips I want to go over to help you listen to today's webinar. We recommend you close any applications that take bandwidth or resources on your device just for a better viewing experience. We will be taking questions at the end of the webinar, so you can type your questions into the questions section of the webinar panel, and we'll take those later. And if you have any audio issues, just make sure your speakers are turned all the way up. And you can always try reconnecting to the webinar if you're having issues. There will be a survey at the end of our webinar today. And we really love to hear what everyone thinks about our webinars, and we'll be choosing one person who fills it out to win a free book. And we also are giving certificates for today's webinar, so you'll receive a certificate in your email tomorrow, as well as for those of you listening to the recording right now, there'll be a link at the end of the presentation where you can go and get your certificate. The slide handouts are also uploaded in the handouts section of the webinar panel, and they're also there's also a link in the chat box if you weren't able to download those earlier. So now I'd like to introduce you to Dawn Alexander. Dawn is the preschool coordinator for the Colonial School District in Newcastle, Delaware. Ms. Alexander was a public school teacher of young children with and without disabilities for more than 20 years, and she served in her current role for more than 5 years. Ms. Alexander was Colonial School District's 2010 Teacher of the Year, and she received the Governor's Excellence in Early Childhood Education Award in 2016. Ms. Alexander is the lead for the Colonial Readiness Team, a member of the Delaware Technical and Community College Early Childhood Education Advisory Board, a member of Delaware's Special Education Strategic Planning Advisory Committee, and a member of the Reading Consortium for Educational Equity Social Determinants of Health Work Group. So welcome, Dawn. We're really happy to have you here with us today.
Grateful to be here. Thank you.
I'm going to give you control, Dawn, now of the screen so you can bring up your presentation.
Wonderful. Thank you so much. Alrighty, well, thank you so much. I'm grateful to all of you for being here today to learn about developmental screening in the state of Delaware and in Colonial School District. And I look forward to telling you how we've really transformed how we do things. So today you'll learn about the Individuals with Disabilities Education Act, the child find component of that act, how we've strengthened that in Delaware and in Colonial School District. You're going to learn about the efforts within Delaware to really streamline the system, to align the work that we're doing, and to increase access for all children and families, and the positive impact of Delaware's adoption of the ASQ Online system, and a perspective from our school district, what that looks like. And then lastly, I'll talk to you about some legislation that will soon be filed in Delaware to increase access to developmental screening. So first, let's talk about Part C. Part C is the component of IDEA that supports infants and toddlers. And the requirement is that every state must have a comprehensive child find system. And so every state is obligated to intentionally seek children who may be eligible for early intervention for children who are infants and toddlers, birth through age 3. So that's the Part C component. And in each state, the governor names the lead agency. And so when you look at different states, the lead agency can be in different departments in different states. So it might be the Department of Education, it might be a health department. So it does look different from state to state. And then the next is Part B. And that's what we think of typically when we think of the public school system. So they're children ages 3 to 21. And also every state must have policies and procedures to ensure that all children ages 3 to 21 who may be eligible for special education are identified, located, and families are given the opportunity to receive an evaluation. And the lead agency for Part B is the Department of Education, and then school districts are the LEAs. So the child find work done in each state is done by the school districts, which are the LEAs. So we use developmental screening to help us meet our child find requirement. So not only is it best practice to make sure that all families have access to developmental screening, it really does help us to meet that child find requirement of IDEA to actively seek children who may be eligible for early intervention services or for special education services. So when we think about Delaware, 20 years ago, our system was disjointed. We had a variety of screeners that we were using. Our screeners were on paper, and data was not systematically captured by programs or agencies. So one agency might use Excel spreadsheets. One agency might keep things all on paper and just have paper copies of things. And we didn't have a statewide system for recording, tracking, or sharing screening information. So we didn't have this opportunity to look at children in certain, let's say, zip codes or in certain areas of our state to determine, are we finding all the children? Are we really reaching all of our communities? Are we making sure that children who are participating in a variety of programs are having access to screening? So we were not systematic in the work that we were doing. And then 10 years ago, unfortunately, Delaware had the lowest screening rates in the nation. We were at the very bottom of the barrel, and it was disheartening, and we knew that we could do better. So our Delaware Early Childhood Council, through our strategic plan, really emphasized the importance of developmental screening, as did our then governor, Governor Jack Markell. So there was a big emphasis to increase access to developmental screening and to set these goals. So through work with Matt Den and through community stakeholders, legislation was passed about 10 years ago to ensure that private insurance to reimburse for developmental screening was put in place. Unfortunately, we found shortly thereafter that that did not increase the screening rate. So Medicaid reimburses for developmental screening, and so we wanted to make sure that private insurance would also reimburse. So with that payment, we still found that we didn't see an increase, which was disheartening. And then when we look at about 10 years ago, the Early Childhood Comprehensive Systems Grant, as well as our 2-on-1 Help Me Grow work, there was emphasis on developmental screening. So we felt that we recognized a lot of work that needed to be done, and we saw stakeholders get involved in that work and become much more engaged. And then 5 years ago, developmental screening efforts really increased and started to pick up. The 2016 Early Childhood Comprehensive Systems Grants became competitive, and Delaware was one of the just over a dozen states selected to receive one of those grants. Also around 17, 18, child cares that were implementing developmental screening and were using the ASQ on paper, as well as our Star Level 4 and 5 programs, began transitioning from paper to online ASQs. Also at that time, it became something of a personal mission to make sure that colleagues understood how using a single system could truly benefit us, how we could meet our child find requirements, but we could also really do much better for children and families. So I kind of took the show on the road, and some colleagues partnered with me in doing that. And we met with our Part B, IDEA Part B 619 coordinators. We met with district preschool teams, leaders of teams, special education directors throughout the state, and early childhood advocates throughout the state. And our mission was to teach everyone who would listen why having a single system and having an online database could really drive the work that we're doing and better serve those in our community. And then also at 18 and 19, we have Delaware readiness teams in the state of Delaware, and teams are throughout the state. And those are teams that serve children birth through 8, include families, community stakeholders. And really what we do with readiness teams are, we look at the needs in different communities and then work collaboratively to meet those needs. And through the leadership of Diane Frenzel with Delaware Readiness Teams, she wrote a grant through Highmark to be able to ensure that every single family in Delaware could access developmental screening for free. So all of this was posted on the Readiness Team's websites. So it was extensive work to reach everyone. And then also through 211 Help Me Grow, we can continue to increase the advocacy for developmental screening. And then 2 years ago, things really took off. So bold, positive statewide changes. And we really saw commitment from so many people to make this happen. In 2019, Delaware received the Preschool Development Grant, and the leadership of Caitlin Gleason at the Department of Education and other state leaders through our health department, or DHSS, and also our Department of Ed. That needs assessment, there was a lot of work done by community stakeholders to implement that needs assessment, as well as to learn from that needs assessment and then be able to make decisions based on all that information. And we recognize that developmental screening, we still had a lot more work to do, and we committed to moving that work forward. In 2019, around that time, our Department of Education created that enterprise account, so that really big account for developmental screening through the ASQ. So prior to that, many of the programs that were using the ASQ, the portals were paid for by the state, but they were individual portals. So we had over 400 programs running their own portal or running their own kind of system for ASQ, but having our Department of Education have that enterprise account really allowed all of us to come together and to have all of our data in a single system. So all the school districts agreed to be reviewers, and our Part C, birth to 3, voluntarily, joined the initiative. And then all of our participating child cares were integrated into that DOE enterprise account. So all of the child cares that are within a district became part of that district's program or system. And then a great deal of work was done to create manuals and materials so we would have uniformity in the project. So the materials that we were using from the top of our state to the bottom looked the same. And having that common language and the common system is so important to make sure that we're best able to meet the needs of children and families. And also when we're working with our community partners, having a single system, using common language really makes a big positive difference. So by 2019, 2020, DOE really took the lead, our Department of Ed, with all districts using the ASQ. And then this year, our Reading Consortium for Educational Equity made recommendations for fiscal year 2022, screening recommendations to make sure many more of our children had access to screening, particularly children who face barriers related to race and poverty. And our 2020 through 2025 Delaware Early Childhood Council Strategic Plan, through the leadership of Madeline Byard, the screening remains a focus. And we're so grateful for all of our Delaware Early Childhood Council leaders to make sure this continues to be a focus for that council. So in Delaware, we're on the cutting edge. We have come very, very far thanks to so many advocates, public, nonprofit, private stakeholders, so many people doing this work. Education and modeling are key to our success. So we know that success builds upon success, and having people who are doing it and doing it well, and to be able to teach each other how to do it, and to say, yes, I struggled with this or that in the beginning, but now I'm able to implement this with fidelity, and this is how I do it. So we're really seeing people partnering and working collaboratively and teaching each other. Our Department of Education is creating a free, easy-to-use one-stop shop. And this system is for all of our families, reviewers, providers, and our Department of Education has implemented a community of practice. So we have some leaders in Department of Education, Cindy Brown, Jenny Grady, Jamie Walko. They've worked extensively to make sure that everything is uniform and we have materials that are consistent. And by bringing together our community of practice, we're able to have these conversations to commit to continuous quality improvement. So by coming together, we can say, well, we thought this would work well, but we think we need to modify it a bit. So continuing those conversations allows us to have standardization and continue that quality improvement. Something else that's worked very well for us through recent legislation, we continue to focus on consolidation of early childhood within our Department of Education to have early childhood governance and to really streamline the work in early childhood. So our Office of Child Care Licensing is now housed within our Department of Education. That really helps us streamline our work. And again, with DOE having that enterprise account, we are able to support districts, birth to 3 programming, and providers all within the Department of Ed. Every school district, as well as birth to 3, has a unique family access link. So when families go in, they're selecting the link that is associated with the district in which they live. And then the child care programs are within the district, again, are considered provider classrooms. So when we as a school district process an ASQ, the results go to the families, but then they also go to the child care, a designee at each child care provider, and then they can see the information. And then currently with our quality rating improvement system, all of our 4 and 5 level, which are our highest level programs, they're required to implement developmental screening using the state system, which again, we've adopted the online ASQ. And then all of our child care programs in the state are encouraged to participate. It's voluntary, so it's not required, but they're certainly encouraged to do so. So this is a peek at what the Department of Education website looks like. And truly, I encourage all of you. I know we have participants from all over the country and in Canada, and we encourage all of you to go to the Delaware Department of Education to look at how all of this work has been captured on the Department of Ed website, and it's very user-friendly. So families, the information is all there for families. The information is there for child cares as well as for districts and our birth to 3 program. So the manuals are online, the links for support are there. So really, it's all in one place. It's very easy to utilize. And then here's another part of the website. So you can see when a family visits the website, it's explained if they need support, but then also there are pictures, or there are icons, pardon me, for birth to 3, and then icons for each of our school districts in the state of Delaware. So, and if families are not sure which district in which they reside, there's a link so they can put in their address to find their district. And here's a snapshot of the workflow. And it may look complex or complicated, but trust me, once you're using it, it really is helpful to have this workflow because we understand when a screening is received, what happens next, and then who's in charge of processing it, and based on the results of the screening, what happens next. So this workflow is very, very helpful based on if a child is on target, if they're in the monitoring range, or if a referral is warranted. And there are also the dark green boxes, and that lets us know when we're going to add documentation to the ASQ portal. That's very helpful for us. So because with the Child Find team, there are multiple people on the team and we all utilize the portal. So making sure that we're all documenting at the same time allows us to be able to review what other people have entered into the portal. And so if I'm talking to a family member or someone else on the team is speaking with a family member, we're able to see information that has been previously entered by other members of the team. So what does this look like from a school district perspective? I'm in Colonial School District. We are in Newcastle County. And what it looks like for us is we have the link that's been assigned to us on our district website, as do each of the other school districts. So families can go to each school district. They can find the link for the developmental screening. It's also, again, on our Department of Education website, on our Department of Health and Social Services. Some of our child cares have linked the website for each, if they'll link the website for the district in which they're housed. And then our Delaware readiness teams, that website continues to have all of the links. It's important to say at this point that some families are still more comfortable using a paper screener. And so if families print it out or if families ask us for a printed copy of the screener, we certainly will give families that printed copy of the ASQ. But when we receive it, we will enter that into the system. So it is still really important that we capture that in the whole system, in the data system, because we want to continue to be able to have that data as part of what we do. So we offer the paper ASQ, but we put that into the data system. So there are so many benefits for us as a district. This system is extremely effective and efficient. When you look at the system that we used to implement, that was all on paper, and we were typing in the information into Excel spreadsheets, and there wasn't a mechanism to be able to really compile all the data in one place. This is so efficient and effective, and it saves us money. So as a district, we receive, we receive money each year from our Department of Education, from the state, to be able to implement Child Find. We are saving money now over what we used to spend on Child Find, and then we're able to reinvest that money into the services that we offer for children. So it's certainly efficient, effective, and it saves us money. This allows us to review the screening and referral data quite easily. So we're able to run reports. We can see how many screenings that we've implemented within a month, 6 months, a year. We can look at all of the referrals. We can look at who's in the monitoring range. We can go back and remind families to rescreen. It's really simple for us to do that. We document the communication with families, as well as child cares can see that. And there are different levels of access. So child cares are seeing the data for the children who are enrolled at their child care, but not seeing the data for all the children. So that's very helpful. And then we can compare children's previous ASQs. So that helps us to be able to speak to families about different areas. And families are the ones that are completing the ASQ. So we're really empowering families because they know children best. So this system, supported by DOE, has significantly positively impacted how we serve children, how we communicate with families, how we collaborate with child cares in our community, and how we retain and review data so we can get better at what we do and ultimately serve children and families better. For us in our district, we have a flyer that we created that's in English and in Spanish, and we aim to distribute this anywhere and everywhere we can. So one thing that we do is we blast this as a PDF to all. So our Office of Child Care Licensing in the state of Delaware has an email contact for all the child cares statewide, and we are able to ask our Office of Child Care Licensing to send blast emails. So we don't have the email addresses for all of the child cares in our district, but the Office of Child Care Licensing does. So we can send them things like the developmental screening flyer and ask our Office of Child Care Licensing to blast this out to all licensed child cares in our area, which they do for us at least twice a year. That's really helpful because even if a child care is not in the portal yet, or they haven't fully adopted the system, they can still choose to give the flyer to families who are enrolled, and families can still participate in screening. We also make sure that all of the elementary schools within our district are distributing the flyer. We have it at local libraries, civic associations, really any community partner who is willing to distribute this flyer for us. We're grateful to have them do it, and we're happy to deliver it to them. So we share this information electronically, but we also share it on paper. And it's important for me to say now that our Delaware readiness teams created postcards that are distributed statewide. So those postcards have the link to the Delaware readiness team website, and that leads them to every single district. So we're reaching families through paper, we're reaching them electronically, and a lot of this information is on all the websites. We also have a Child Find staff member who is dedicated to screening related work. So we have a whole team, a Child Find team, which districts have, and Part C has, birth to 3. But for us, we have a staff member who is dedicated to the screening related work, and our Child Find team in Colonial, I can't say enough about the work that they do and their commitment to making sure that families receive information in a timely fashion. It's very quick, and to make sure that families really understand the process. And so Jen Vicari and Marissa Pettico, I really give it up to you for all the work that you do in Colonial. And Marissa makes sure that the screenings are turned around like that, in just a couple of days. So families get that information quite quickly. So what does this look like moving forward for us as a state and as a district and as a state? Our Reading Consortium for Educational Equity is really looking at what we can do. We're looking at national data and state data to say what can we do better as a state, and what can we do better in our target areas in Newcastle County, in the city of Wilmington, to make sure that we meet the needs of children who are traditionally excluded and have not had access to programming. So we know that national research demonstrates that Black and Brown children are 5 times less likely to access early intervention services. So we need to make sure that our communities that are serving children who are traditionally underserved have access to developmental screening. That must be a priority for us. We need to make sure that every single family in Delaware knows about developmental screening, and every single child birth to 5 receives this screening, every single child. So some recommendations are ensuring that all child care statewide implement developmental screening, and we have some legislation that will move us forward that I'll talk about in just a moment. Our 211 Help Me Grow work is piloting a referral system, which we'll talk about soon more, but we're excited about that. We implement books, balls, and blocks events, and those are successful. And we moved from in-person to online. And in Delaware, our team, our ECCS team, has applied for the next round of grants. So we hope to hear soon if in Delaware we've received that grant. So legislation, I encourage all of you to go to the Delaware legislative website, and you'll see some legislation that is soon to be filed this week and or early next week. So 2 pieces of impactful legislation. One will be to have all of our licensed child cares in Delaware implementing developmental screening at least once a year by July 1st, 2023. And over the next 2 years, our Office of Child Care Licensing through our Department of Education will be working very hard to ensure that training happens, professional development. So all of our child care partners will be ready. They'll know what they need to do and how to do it to be able to implement screening with all of their children, to make sure families are be able to complete the ASQs. And then looking at another piece of legislation, it's to move our IDEA Part C, which is currently in our Department of Health and Social Services, moving that into our Department of Education. And that's really to streamline services, to make sure that we've consolidated efforts and consolidated efforts in our state. So we want to make sure with early childhood we're aligned in the work that we do, that we better serve children and families, and we better support our workforce. So being within one department will allow us to do that, certainly in our professional development and looking at what we do with developmental screening. So we can further align that work. And then certainly next step. So our Delaware Early Childhood Council, our strategic plan is 2020 through 2025. We have much work, we've done much work, but we have a lot more work to do. And again, I encourage you to go to the Department of Education's website where you can find the link to our strategic plan to learn what we're doing, what we plan to do, where we're going from here. And then efforts that we know we need to strengthen. We have medical professionals who are championing this work, but we encourage many more of our pediatricians in the state of Delaware to be developmental screening ambassadors. So those of you who are on this call in Delaware, pediatricians, if you work in medical field, we need more in the medical field who can really make sure that families understand the importance of screening, and colleagues. So right now in Delaware, when it comes to compliance with developmental screening in our medical offices, that's not happening with Fidelity. So that's an area that we need to strengthen, and we know that we need to do that. So we're working on that. We need to align the data that we have that's within our Department of Education and then our health department. So we're not there yet, but so we know it's work that we need to do. The Medicaid EPSDT program compliance rates in Delaware, we're at about 27% of children around age 2 when they go to well visits. About 27% are receiving developmental screening. So we know that we can do much better. That's an area where we need to continue to get stronger. So, and lastly, looking at the AAP's schedule periodicity, making sure that all children have access to the screening and preventative measures that are in those recommendations. So areas where we continue to need to work. So lastly, I just want to thank all of my colleagues who have worked tremendously hard through Colonial School District and also throughout the state to make the developmental screening and some of our national partners to make this work what it is. We couldn't be where we are now without all the people who are here. I try to list everyone. If I forgot anyone, forgive me. But I'm just so grateful that we've come to where we are and the commitment of everyone to move our work forward. And I look forward to answering any questions that you have. Thank you.
Great, thanks so much, Dawn. So listeners, if anyone has any questions, please go ahead and type those into the question box, and then Dawn and I will take those in a Q&A format. So Dawn, we did have a couple listeners actually who were asking about how you handle privacy issues with so many families and children in the same system, so that everyone can't see the data for the kids.
I'm grateful for that question. So within the ASQ system, you're able to set different levels of access. So the Department of Education is the administrator of the system, the enterprise system, and they're able to see all the information. But then let's say for Colonial School District, we have just a couple of people who are administrators who are able to see all of the children who have been screened through Colonial. But at different child cares, a child care will designate a person who can see just the children who are attending that child care. So we're grateful for the system that's been set up within the ASQ to ensure the different levels of access and the ability to view information.
Okay, great. Let's see. We have a question about the eligibility rate. So what has the eligibility rate been with qualifying for services using the ASQ? Do you track that information?
So I'll tell you, it varies from year to year. So the past couple of years have been tricky for us. As you know, we're all in a pandemic. So I would say we moved fully to the online system before the pandemic hit. And so yes, we will track that, but it's really difficult to give those numbers right now because we've had a lot of families for whom we've made referrals, and we followed through with families, but because of everything happening with the pandemic, we've not been able to follow through at the rate that we would hope. So the answer is yes, we'll be able to track that information, and we certainly will. And as a state, what I do encourage everyone on the call to do is this. A couple of our colleagues from the Department of Education are hoping to be able to present on us as a whole state hopefully in early fall maybe. And I hope that we'll have much more data from the past, let's say, few months, because most of us are back in school now. It may not be part-time or full-time for everyone, but we're in school part-time, and we're getting families for whom referrals were made and they were reluctant to follow through with referrals or evaluations. We're seeing many more families follow through. So I do like numbers and I like data, so I'm sorry that I can't give a really good answer right now, but we'll be able to give that once we have a few more months of data.
Okay, great. We had a listener just ask, the majority of the screenings that you see come through, are they from child cares, or do you receive a lot of screenings from just the general community from families who aren't in child care?
So I would say that, so we publicize so many of them are child care. If I had to guess, I'd say, or look at the numbers, I could run a report right now, but I can't do that in front of you because of names. I'd say about 50 to 60% are from child care. But prior to pandemic, I'd say more, because we were out as a district, we were out at community events. So if our local libraries were having a Saturday event, we were there meeting families, talking about developmental screening, promoting developmental screening, as were our partners doing books, balls, and blocks events, or parents as teachers, or lots of our community partners were out on the ground meeting families. That has dropped because we're just not able to do that right now. But our child cares have been going since the pandemic hit. So right now, more of our screenings are from child cares, but I expect that as we're out in the community more, again, we'll see that more will be from being out in the community. But we hope with the legislation to be able to really meet more families, meet more children, screen more children, meet more families through child care screening.
Great. We have a listener asking, how many Part C child find staff dedicated do you have per county that are dedicated to developmental screening per county? Is it the same across the board?
The screening work is done statewide because it's all done through the portal, and I'm not sure if any of my Part C colleagues are on who could say how many people are doing that right now. So I can talk about the districts, but the number of people doing it for Part C, if you email me, I know that I'm pretty sure I have some Part C colleagues on the webinar. So if you put my email.
You also can enter in the question. If you enter it in the question box, I'll see it.
Okay. So that is an answer I can get for you, even though I can't answer it right this moment.
Great. Okay. Let's see. How do you assure that any immigrant or refugee families that fill out questionnaires, that they're safe and that answering the questionnaires won't affect their status? Do you have that issue?
So we support all families who complete the ASQ, and we strive to complete the ASQ in home languages. In Colonial, we have a contract for which we pay to be able to translate in any language of the families, and we don't disclose information regarding anyone's status. So for us, it's important just to make sure that we support families, and we share the information from the screening with them, and we help them access any services that their child may be eligible to receive. So I can speak for Colonial that we don't ask about that, and we just want to serve children and families as best we can.
Great. Let's see. We had. What advice would you give to agencies who want to bring this topic to their DOE on how critical it is to adopt ASQ and make statewide awareness and change? Do you have any advice for our listeners?
So about 3 years ago, when I took Michelle on the road, I created a PowerPoint, or it was actually a Google Slides, that I shared with as many school districts who would listen, and I showed them the impact on efficiency, effectiveness, data collection, and cost savings. And whoever you are, who wants to know, I'd be happy to share that with you, because it doesn't have any data or information about, that I couldn't share. But I would be happy to share that presentation with you, because even though it's dated by a few years, you can see how we were able to look at, this is what we're spending in Delaware, this is what we're spending in districts to use a paper system, and not just the money, so not just the money that it costs to implement a paper system, but also it's the people hours and the materials. So with these paper materials, you are having to purchase these paper protocols, but then you're also paying people. So if you're using a paper system and you're having someone go do the screening, a person, you're excluding a family, and the family knows the child best. So the ASQ empowers the family and really validates the input of the family because they're completing the ASQ. And the paper system we were using didn't do that. So this is what I presented to districts. This is a tool that's research-based. It's shown to be one of the best tools. It includes families, it saves you money, and it helps you track your referrals. So what my advice to you is, I'll share the PowerPoint with you. You take it and you modify it for your state or your department, and you get the public, the budgets for each state and each department, they're public. So find out what the budget is for child find, or find out what the budgets are for developmental screening, and look at how you can save money. So I'd be happy to, if you want to email me, I'll share that with you.
Great. We have a listener who's asking, when you talked about licensed child cares, are you talking only about center facilities or also home-based?
We're talking about all, so that will be home-based as well. And we recognize that there may be challenges, there may be more challenges for home-based centers. Some of our home-based centers may not have the access to computers. It's important for us to know that we're implementing systems. So we want to make sure that we set everyone up for success. So this would be everyone, every licensed child care program. What we love about the ASQ Online is you don't need a computer. You can use a computer, you can use an iPad, but a lot of our families are completing the ASQ using a smartphone. So they're using whatever smartphone they have to complete the answers to the ASQ, and we can do it on paper, and then we can help to get that into the system. So we're working on what that would look like as a state and how we can support smaller centers and home-based centers to be successful in that implementation. So the 2 years will give us a lot of time to create that timeline and set people up for success.
Great. Thank you. Let's see. So we have a couple listeners asking about recordings. So we are recording our webinar right now, and everyone will receive a link tomorrow. It'll also be up on YouTube on the Brooks channel, and definitely you're welcome to share that with your staff. We did have some of your colleagues from Part C write in about the number of.
Thank you.
So there are 3 reviewers from Part C and 1 coordinator who oversee the Birth to 3 early intervention portal in Delaware.
Thank you, Part C partners.
Okay. So we have a listener she's asking, are both the child cares and are the doctor's offices having parents fill it out through your portal as well as the child cares? And if so, what do you do about duplicate entries for kids?
So the answer is no. So right now at the doctor's offices, they're using the SWIC or the PEDS or the ASQ, and some are doing it on paper. So that's definitely an area for us as a state that we do have some partners who are really committed to moving this work forward, but we don't have a unified system in Delaware like for our medical practices. So we have this in childcare and school districts and Part C, and some of our home visiting programs are using the Department of Ed portal, but we're not there yet with our medical partners, and that's where we need to go and figure that out. So no, and so pediatricians can have our flyers in their offices, and we know that some of them have the Delaware team's postcards, but we don't have a system in our state right now to figure out where it's happening in which doctor's offices as a whole state.
Great.
Not yet.
Not yet. We have a listener who's asking, do you have any data or results yet to suggest that children who traditionally face barriers to accessing EI or ECSE services, that this is helping them get more access or quicker access?
So we don't have that yet. We don't have that yet, and we hopefully will when the legislation, it'll take a couple years. So no, again, pandemic. So this all went online around 2019, you know, and our DOE, our Part C partners were working very hard to get everyone online with the enterprise system, and then the pandemic hit. So not yet, but we know that we will. And we know that when we have all of our childcare partners with fidelity in every corner of our state implementing yearly screening, we know that we're going to reach many more children whose families are living in poverty or facing barriers of access.
Great. Thank you. We have a couple questions about how you work with families after they complete the screening. So do you, in your school district, are results shared with families by email only, or sometimes do you call families to discuss, or does it depend by childcare?
Yeah, it's both. So what we hope, and it looks a little bit different. So our goal is to be the same district to district to district. I mean, that is our goal, is to have a uniform system. Are we perfect yet? We're not. We will tell you, you know, and I think anybody from Delaware who's on this webinar will say it's continuous quality improvement. So our goal is to have a uniform system, and we continue to work towards that. So everyone gets it through email if they have email. If they don't, they get it through US mail. And then how we handle phone calls looks different from child to child, and based on results and based on the support that families need to understand results. So it's going to look different if there's a referral, or if there is monitoring, then we're much more likely to have that, you know, that conversation, as opposed to if a child is, everything's on, as it should be, you know, on target. And we also partner, our hope and expectation and our goal and our partnership with Head Starts and with our childcare partners is, because it goes to the family and it goes to the childcare, we are in this together. And we have itinerant services where we have special education teachers and therapists who go to the childcares where children have identified special needs, go to childcare. So our goal is to not have every child come into us at the center. We want to meet the needs of children where they are. So if they're in a local community center and they have an identified need, our itinerant staff go out to them. So we have relationships with our childcare partners. We want to make sure that, but with that said, the childcare partners know families often better than we do, because the families are seeing families every single day. They see them at drop off and pick up, and every day, where the Colonial employee might see a family once a week. So we know the relationship is with our provider partners, and that's why the conversation may be with the district, it may be with the provider partner, it may be that the district staff member and the provider have a conversation, and then they say, okay, now let's talk to the parent together. So there are lots of ways to do this, to partner. And it's not that there's a, you know, right or wrong way, but we want to make sure that we have the people who know the families best really answering their questions and being able to help them understand why developmental screening is so important and why early intervention is so important. And the earlier we meet children's needs, if they're eligible, the better. You know, the long-term outcomes for early intervention are tremendous.
Great. Another question. Another question about families. So once a family fills out a questionnaire for a child and they're in your system, do you go back to them in 6 months or a year to rescreen those kids?
So what we do is the expectation is the rescreen. The expectation is that we screen children based on the American Academy of Pediatrics schedule of periodicity. It's a lot to say, but I can, I don't know if I could type that into the chat box, or someone else could do that. But if you Google American Academy of Pediatrics schedule of periodicity, or American Academy of Pediatrics Bright Futures, there are recommendations for when children should receive developmental screening. And that is through their pediatricians, but we try to follow that in early learning as well. I'm in a program that's a preschool program. So by that age, we're looking at screening when children are around age 3 and again around age 4. So we do it yearly. With our younger part, with programs that serve children who are younger, the recommendation for screening is more frequently. So we don't serve, we in our in-house program don't serve children that young, but our child care partners do. So we encourage child care partners to have children screened or to have families complete the screening in alignment with those recommendations. And at least once a year, but in recommendation with the AAP. So do we go back? Yes. How we do that? So some people can put it into the ASQ, which is great. You can set up reminders within the ASQ to remind you. So if you're the lead person for your program, you can set up your own reminders within the system, and then it reminds you. That is so helpful. Or you can put it in your Outlook calendar, or you can have it so you send home reminders to families at 3 months, 6 months. There are lots of ways to do it, but we do encourage people to follow the AAP's recommendations. Great. But it is helpful that the ASQ has that built in, and our expectation is that follow up.
Okay. We have one last question that we'll take, and then we'll finish up our presentation. We have a listener who's wondering, did you have to ramp up your evaluation capacity after universal screening was implemented?
So sure. So more screening does equal more evaluations. And so, yes. And finding children as early in life as possible is a great thing. I was a special education teacher before I moved into this job. My first love is, early childhood special education. And we have decades of national research demonstrating that the earlier we serve children who are eligible for early intervention or special education services, the better for the child, the family, the system, social services, you name it. Children who receive early intervention very early in life are more likely to graduate from high school, read on grade level at 3rd grade, be gainfully employed as adults. I could go on and on and on. So yes, you have more evaluations, but it's a good thing because we're finding children earlier, and that's what we're committed to do. That is what IDEA calls us to do as lead agencies. So we are fulfilling our child find requirements by doing so.
As a follow-up question, did you need more funding or to hire more staff to do those evaluations?
In our district, so in Colonial School District, several years ago, we didn't have a designated child find team. We had a team of special education coordinators and therapists, school psychologists, and a child find coordinator working to support children and child cares who were, or families who were not enrolled in the building in the center, as well as supporting all the children and families and staff in the center. And when we ramped up or when we increased screening, we were able to find more children at a younger age. So we were able to advocate within our own system, in our own district, to create a child find team dedicated to child find. So a psychologist, what we call a child find teacher, who is doing the screening work, the screening support, the child find coordinator, the speech therapist, OTPT. So we have staff who are committed to that child find work. And then we have staff who are committed to doing the in-house work. So what I would encourage all of you to do is to advocate for the additional support. And that's something that we're doing at the state level. We know right now we have legislation that just yesterday, we have some legislation that we were able to get approved in our House Education Committee that will better support preschool special education to make it more aligned with our 4th through 12th grade. So higher funding for special education in preschool. So as a state, we're recognizing that more children will need these services that's going to need more support and more funding. So if we put the money in the front end, then we'll need less support in the back end. That's really the work that we're trying to demonstrate.
Great, great. Well, thank you, Dawn, for answering so many questions. This was a very good Q&A.
I'm so grateful for this opportunity, and to everyone who spent time with us this afternoon.
Great. And Dawn's email is in the chat box. So if you had any follow-up questions, her email is there, and you also can reach out to Brooks as well. My email is going to be on another couple slides. So I also just put the link to a certificate in the chat box as well. Let me move back to here. Well, I just wanted to let all our listeners know that we do have 2 previous webinars in our ASQ Innovators series. So the URL on your screen there, you can watch the recordings. And if you're an ASQ innovator, we'd really love to share your program story. We plan to restart our webinar series in the late summer and fall. And so we're looking for some ASQ users who'd be willing to present a webinar. So please reach out to me. Brooks is also hosting some free coffee chat webinars on Wednesdays. So we have a couple early childhood ones coming up over the next several weeks. So we invite you to participate in those as well. And I also just wanted to make sure everyone knew that the ASQ website has a wealth of resources. There is a training portal with some training materials. There's a resource library with more than 300 infographics, webinar recordings, videos, sheets. There's also a networking where you can register yourself and select your state and setting, and put your email address in so other people can look you up, and you can look up other people in your state that are using ASQ. So I encourage you to register on the Ages and Stages website for all of those resources. Just another reminder, there'll be a survey. So when you quit end the webinar today, you'll be prompted to a survey, and also the email tomorrow will have a link to the survey. We'll be choosing one person who fills it out to do a free book. Here is the link for the certificate, especially if you're listening to this recording after the fact. You jot down this URL, pause your recording, you can get your certificate. For those of you who are listening, you can use this URL, it's in the chat box, or it'll also be, you'll get a certificate attached to your follow-up email tomorrow, and the recording will also be linked in that email tomorrow as well. So thank you very much for joining us. And Dawn, thank you very much.
My pleasure. I'm so grateful for everyone's time. Thank you.
Great. All right, and we hope everyone has a great day.